Are abnormal cervical screening results always serious? When it comes to cervical screening results, many people wonder if an abnormal result is always a cause for concern. The good news is that abnormal cervical screening results are not always serious and do not automatically mean that a person has cervical cancer. In fact, most abnormal results indicate changes in cervical cells that are not cancerous. These changes may require follow-up to monitor or treat potential precancerous conditions. Cervical screening tests, like Pap smears and human papillomavirus tests, are designed to detect changes in cervical cells. These changes can range from mild abnormalities to more severe precancerous lesions. An abnormal result simply means that some cervical cells look different from normal. This can be due to infections, irritation, or minor changes that often resolve on their own without progressing to cancer. The seriousness of an abnormal result largely depends on the type and severity of the cell changes found. For instance, atypical squamous cells of undetermined significance, often abbreviated as ASCUS, are mild abnormalities. In these cases, it is unclear if the changes are due to an infection or precancer. Most ASCUS results do not indicate precancer but requiring further human papillomavirus testing to assess risk. Low-grade squamous intraepithelial lesions, known as LSIL, representing mild abnormalities that typically resolve without treatment. On the other hand, high-grade squamous intraepithelial lesions, referred to as HSIL, are more severe abnormalities. HSIL has a higher risk of progressing to cervical cancer if left untreated and usually requires further evaluation and treatment. Following up on an abnormal screening result is crucial. The follow-up care is tailored based on the specific test findings, previous screening history, and personal health factors such as age. Follow-up may include repeat screening tests in 1 to 3 years, colposcopy, which is a detailed examination of the cervix, biopsy, or treatment of precancerous lesions. The goal of this risk-based approach is to detect and treat severe cervical cell changes early, preventing cervical cancer while avoiding unnecessary procedures for mild abnormalities. Therefore, not all abnormal results are serious, but appropriate follow-up is essential to manage any potential risks effectively. In summary, while abnormal cervical screening results indicate that further evaluation is needed, they do not always signify cancer or a serious condition. Most women with abnormal results do not have cervical cancer, and many abnormalities resolve without treatment. Timely follow-up according to medical guidelines ensures early detection and prevention of cervical cancer. Always consult with a healthcare professional for personalized advice and guidance regarding cervical screening results.